Hello, and thanks very much for stopping by. It's been quite some time since I've made a video, but President Trump's interview that was just aired on HBO was so problematic that I decided I had to make this video and hopefully a series that go more deeply into some of the serious problems with many of his assertions. I thought that I would start by reminding us that in May 4th in particular, where I've been grabbing data all throughout this epidemic, the Johns Hopkins dashboard recorded 1.15 million cases worldwide, with the U.S. being in the lead, and 67,000 deaths. So May 4th, it's August 4th, so that's 3 months ago, right? Now, if we skip ahead to June, toward the end of June, we've gone from 1 million some odd to almost 10 million cases worldwide and 500,000 deaths. And we jump to August, and we're now at 18 million worldwide and almost 700,000 deaths. And there's a lot of reasons why we, I think, suspect or actually know that these estimates are underreported, in part because of the challenge of getting all of the cases and because some of the larger governments across the world have, I think, intentionally underreported statistics, and it's looking more and more like the U.S. may be one of those. All right, so Trump gave a video to this program, Axios on HBO, and it was a really fascinating discussion, and I have to give kudos to the interviewer for his tremendous job staying cool and providing significant factual rebuttals to some of Trump's claims and getting that discussion going. So the way this is going to work with this interview is I'm going to try to show you video clips that hopefully I'll be able to hear them while I'm recording them, and talk a little bit about them. And at the end, I'll show you some of the data that President Trump actually showed to the interviewer, Jonathan, because there's enough detail I can get from the imagery on the camera to actually be able to tell you exactly where those data came from. And surprisingly, they're not from the U.S. government or the CDC or the White House. They're actually based on data collected by a different organization outside the U.S. and graphed by yet another different organization outside the U.S., which I think will be involved in video too. I'll show you those data. They're accurate. It's just astonishing that the White House is downloading freely available data from other places rather than having their own in-house, highly accurate, highly carefully created, curated data and graphics. All right. So the two of them sat down in the Oval Office, perhaps. This was Tuesday, July 28th, but it aired, I think, a week later. I think it aired Monday night. So here's my first, my overall opinion. Trump either doesn't understand even the most basic elements of the challenge that we have with this pandemic, so complete ignorance, or an appalling indifference to the lost lives. As you'll see, he talks tremendously about our testing, which he says is the best in the world. And it's true, we've tested more than anyone else, but it's still actually inadequate for what we need, and ignores the just tremendous human toll this pandemic has had. So this is my first hope-to-be video where we can hear the same things. In which Trump claims you can't test too much, and you know that, Jonathan. Jonathan replied, "Who said that?" And Trump's rebuttal was, "Read the manual." No explanation about what the manual was. And in fact, you can't, well, we're very far from testing too much. We're not testing nearly enough. So I'm going to play this, and hopefully you'll hear it, and so will I.
Well, we have great testing. We're doing, and
by what
other
date?
people do. Let me explain the testing. We have tested more people than any other country, than all of Europe put together times two. We have tested more people than anybody ever thought of. India has 1.4 billion people. They've done 11 million tests. We've done 55. It'll be close to 60 million tests. And, you know, there are those that say, you can test too much. You do know that.
Who says that?
Oh, just read the manuals, read the books.
Manuals?
Read the
What
books.
manuals?
Read the books.
What books?
What testing does.
No, I'm
is
sorry.
Wait a minute,
Who
Joe.
said-
Let me explain.
Well, it turns out I can't hear that on my headphones while it's playing, but I hope you found that interesting. But as you'll see, there's an assumption that Trump's knowledgeable, and when he is challenged, he basically says, you know, it's well understood and you should read the book, when in fact Jonathan has done his homework and knows what he's talking about. Moving on, this was an important claim made by Trump about the ability to test too much. Trump made the important claim that when he took office and he took over, we didn't even have a test. Well, he took office 3 years before the virus actually migrated into humans, so nobody had the virus because it didn't exist. The virus was not a human threat. So it's a bizarre concept. It's a bizarre comment.
Mr. President, I want to talk about the federal intervention.
Excuse me,
Yeah.
one thing I would say about
Yeah.
testing. Because we test so much, we show cases. So we show many, many cases. We show tremendous number of, I know you're smiling when I say that,
No,
but
but
I'm
come on.
telling
I
you.
mean, I've heard you say this,
Other
but
countries don't test like we do,
you know-
so they don't show cases.
just a couple of points on that. I wasn't going to continue on the testing, but you said it. So we're testing so much because it's spread so far in America.
We're
And
testing
when you
so much because we had the ability to test.
Okay,
Because we came up with
but
tests.
South Korea-
Jonathan, we didn't even have a test. When I took over, we didn't even have a test.
All right, moving along in this interview, and these have been clipped in order to try to make them shorter. This part of the interview is probably 10 minutes long or 12 minutes long, and I have it in some 40 and 50-second pieces that cover about half of it. At this point, President Trump is saying that the evidence shows that we are lower than the world, lower than Europe. And what he's talking about is case fatality rate, the deaths per number of cases detected, and you'll see that that becomes an important part of the discussion.
The figure I look at is death, and death is going up now,
Okay,
and it's 1,000 a day.
If you look at death.
Yeah, it's going
let's
up
look.
again.
Let's look.
Daily death.
Take a look at some of these charts. Well, right here, the United States is lowest in numerous categories. We're lower than the world.
Lower than
We're
the
lower
world?
than
What is that?
Europe.
In what?
Look.
In what?
Take a look.
Oh, you're doing death as a proportion of cases. I'm talking about death as a proportion of population.
So just those two glimpses of that sheet of paper, I can tell you exactly what those 4 lines are, how they were made, and so forth. So you'll see it's quite compelling. And Jonathan, to his credit, figured out exactly what was being shown, and then talks about the problem, which is that he's talking about overall mortality as a proportion of the population, not proportion of people tested, because testing varies wildly between places and times, but the overall number of people that have died per capita or per million people is a really good metric to compare the impact of COVID in different countries. So let me play this for you.
Oh, you're doing death as a proportion of cases. I'm talking about death as a proportion of population. That's where the US is really bad.
Well,
Much worse than South Korea, Germany, etc.
you can't do that. You have
Why
to go.
can't I do that?
You have to go by. You have to go by where. Look, here is the United States. You have to go by the cases. The cases.
Why
are
not
there.
as a proportion of
When we have
population?
somebody says,
It's surely a relevant statistic to say if the US has X population and X percentage of death of that population
no,
versus
because you
South
have to
Korea.
go by the cases.
And I can show you exactly where that bar chart comes from, because it's the same place where the line chart came from, and in fact is the same data, not a second piece of evidence. But I don't think President Trump understands that those two graphics are identical, one of which is just a permutation of the other. So one of the things that Jonathan quoted is that, look at Korea, 50 million people, 300 deaths. So the U.S. has maybe 350 million people, let's just say. That's 7 times as many people as Korea. So if you take Korea's population and its number of deaths and you multiply them by 7, if Korea had 350 million people, they would have recorded 2,100 deaths right now. If it's the same proportion that they're reporting, 2,100, we're reporting 150,000. So that means we are 70-ish times, 75 times higher per capita. So that meant if they are having 1 death per million people, we're having 75 deaths per, did I say 75 deaths per million people? Yeah. So it's a dramatic difference, ridiculous. And that's what he's pointing out. Trump then questions whether Jonathan knows this and tells him he's not reporting it correctly, which in fact he is.
Look at South Korea, for example. 51 million population, 300 deaths. It's like, it's crazy.
You don't know that.
I do. It's on
You
the...
don't know that. But you don't know that. And they have spikes. Look, here's
Germany,
one.
low, 9,000.
Here's one right here, United States. You take the number of cases.
Okay.
Now look, we're last, meaning we're first.
Last, I don't know what we're first in. As a what?
Take a look.
Okay.
Again, it's cases.
Okay.
And we have cases because of the testing.
1,000 Americans are dying a day, but I understand on cases it's different.
No, but you're not reporting it correctly, Jonathan.
I think I am, but...
And at this point, I think Jonathan's ready to move on, but President Trump brings it up again, another piece about this. And again, Jonathan's trying to point out there's other more appropriate ways to look at this.
Take a look at this other chart. Where we test more. We have now. Take a look. The top one. That's a good thing, not a bad thing. The top, Jonathan.
If hospital rates were going down and deaths were going down, I'd say terrific. You deserve to be praised for testing, but they're all going up.
You know, they very rarely talk.
60,000 Americans are in hospital.
If you watch the
1,000
news or
dying a
read the
day.
papers.
Isn't that brilliant? So yeah, sure, whatever about testing and cases, but the bottom line is what's the impact of the illness on the country? Well, deaths are going up, and that's a problem. This is Trump's rebuttal and Jonathan's comment about that.
You watch the
1,000
news or
dying a
read
day.
the papers. They usually talk about new cases, new cases, new cases.
I'm talking about death.
Well, you look at
It's going
death.
up.
Death is way down from where it was.
It's 1,000 a
Death.
day. It was 2,500. It went down to 500. Now it's going up
Death,
again.
excuse me, where it was is much higher than where it is right now.
It went down, then it went up
spiked,
again.
But now it's going down again. It's
going
going
up.
down in Arizona. It's going down in Florida.
Nationally,
it's
it's
going
going
down
up.
in Texas. Take a look at this. These are the tests.
It's going down in Florida?
Yeah, it leveled out and it's going down. That's my report as of yesterday.
Anyway, Mr. President, if I can change subject.
It is going down in Arizona.
Arizona
going
it
down
is.
in Texas.
Arizona it is. Texas
And it
has
is
big
spiked,
problems.
And it spiked and it's now going down in Florida. It's evened out and going down in Florida.
So these issues deserve a fair amount of discussion and data, and I think that we need to look at that. So in the next video, I'll show you the exact graphs used by Trump, where they come from. They're actually from a website that is incredibly well structured to allow you to customize comparisons. You can choose different countries and different time periods to make those comparisons and different metrics. And so you have to be thoughtful about which ones you choose. It's interesting when Trump said very early on that we're better than the world and Europe, and you're thinking to yourself, well, there were 4 lines: the U.S., the world, and Europe. What's the 4th? The European Union. So the graph has the world, the U.S., Europe, and the European Union, all of which contribute to the world. So there's some redundancy and sort of tautology there. This is the first graph that I can see over his shoulder, and I'll show you, I'll prove that I know where this came from based on all these annotations which actually tell you where it came from. And the second one as well, here's the teaser about how you can tell that. So this is a short video to tell you I'm going to be making hopefully a series of videos where I really try to set the record straight and combat information about masks and spread and aerosolization and school reopenings and the possibility that we're going to be in a very bad situation very, very soon. I mean, we're already in a bad situation at 150,000 deaths. It's virtually assured that we're going to hit 200,000 deaths before mid-October or early October. I wouldn't be surprised if we hit 250,000 by the end of by Christmas. And the problem was, and very clearly is, behavior and inability to take this seriously. And it's going to continue to just destroy our economy and destroy our quality of lives until we learn to live with this virus and not pretend it's just the sniffles or the flu. Thank you for listening, and I'll be doing more of these, I really hope. I've started about 30 of these since my last video, and I keep running out of time to post them, and by the time I get back to them, they're out of date. So this one I wanted to get up right away. You take care.